And now we come to the first presentation from Marc Nyssen from Belgium. Marc, the floor is yours.
Yes, thank you, Pedro. Thank you, Mladen. Thank you, Tom, for inviting me. Just in 10 minutes is a short time, of course, so I limit to a very few points from my experience and from, let's say, the interest in the topic. Yes, next slide. Next. So, from the global perspective of digital health, the basic requirements, maybe in connection with what Mladen showed, we should ask the question, how can healthcare benefit from the digital interventions? We have, I show you a few points there about national policies and trade-offs. And then we go to the impact, and I will also tell you a few examples. Yes? Next slide. Thank you. Basic requirements. First of all, there should be a solid and well-funded, stable healthcare system. Otherwise, digital interventions will be more futile. Another essential point that we see in many countries missing is a unique patient ID. This is a very simple concept, but apparently not realized in many places of the world. Adequate security and privacy is another point, and there, since 2018, as a worldwide example, is the GDPR from Europe. We have a very good system in Europe that is now being implemented in the whole society, and we see the benefits of it also in the health system. It's a very solid basis that can be taken as an example worldwide. Another point is no double work. By introducing electronic features, it should be absolutely avoided that the people in the field are confronted with double work, paper and electronic. This is a very bad point, and it should be avoided at all costs. It's a challenge to go straight away from paper to electronic, but it should be realized. Then, of course, we need a solid and reliable technical basis. And a word that I didn't hear with Mladen is appropriate. Appropriate technology is an absolute must, or we will do the wrong things. And then, of course, we need affordable telecom links, which fortunately become more and more around the world. And another point, recognition of engineers and biomedical technicians as valid, as valuable and rewarded people. Otherwise, they get stolen to other fields of development. Next slide, please. Then the national policies. We see that there is always a trade-off between the following points. First of all, centralized via decentralized. This is a problem, and the appropriate good mix of centralized and decentralized features is absolutely a choice that must be made correctly. Coordinations versus regulation. Also, this one, regulation can be a very big hindering of the technology that is deployed, and coordination is the better way to do it. But this must be on the national level. The policy should see to be regulating appropriately, but coordinating maximally. Then encouragement versus penalizing. There we see that the result-based funding of medicine in the medical system is more and more gaining weight. So this is a good way to do it by encouragement. Finally, international context, the standards where available should be used and should be appropriate. The impacts, we can see a few impacts. I don't mention here the global impacts of the WHO's source of information, which is usually underestimated and underused, but we go to a few examples where it was implied. We have the Open Clinic GA example. We have DHIS2 in the reporting field, medical equipment management and electronic prescriptions, which are examples I will briefly show. Yes, the Open Clinic. Next slide, please. Thank you. Open Clinic GA is an open system for management of hospitals. And here we see the typical example of take-up in the number of registrations in a hospital in Lubumbashi. And this is only one example. We have now more than 600 Open Clinic implementations in clinics in the world, and they are extremely fruitful, very positive. By the way, thanks to Open Clinic, we could monitor the fact that in African countries, we didn't find significant dying of in the COVID period. So this is a proof that indeed in African countries we're not so heavily impacted so far, and hopefully never, by COVID. Next one. Next slide, please. Thank you. The University of Oslo introduced DHIS2. It is the District Health Information Software that is doing the reporting now in more than 100 countries. And this is a very big plus value for knowing what is going on in the country at national and international levels. This is a major advancement, and you see the propagation in some parts of the world. I'm surprised South America is not so much impacted yet, but it's a very good system that should have more impact. Yes. Next slide, please. In Burundi, since 2017, we introduced management of medical devices by the computer aided, with a central database in the Ministry of Health, and the impact is tremendous. We see here in the result of 2 provinces in Burundi, and the number of interventions rising. Also the number of equipment, that I don't show it here, but the equipment which is well maintained is also increasing likewise. So we have impact if the appropriate technology is introduced. Yes, next. On the other hand, in Belgium, we have a very large project for different aspects of electronic medicine. One of them is the project for the electronic prescriptions. And here you see the take-up of and the rise of the number of prescriptions which were made electronically. At the moment, in 2021, we are reaching 100%. So in the appropriate technology in the appropriate environment gives results if well managed. Next, please. So in conclusion, in this short 10 minutes, I would make a point that if we want to go to universal coverage and the maintenance of a system that protects the largest part of the human population, it is unthinkable without adequate e-health developments. That's my conclusion here. Thank you very much.
Thank you much for your kind presentation, very interesting.